The Isaiah Factor Uncensored starts right now.
And welcome to The Factor Uncensored. We are being warned there's a variant on COVID-19 all across this country right now. And there are vaccines out there that health experts say could work if they are administered. And that's part of the problem in Houston and around the country, getting the COVID vaccine in your arm. And we discuss it with our panel tonight. And let's welcome our guest here on The Factor Uncensored. Already today, Harris County Judge Lena Hidalgo said it's like the Hunger Games trying to get the COVID vaccine, at least here in Harris County. Charles, you've always been pushing that the federal government should focus more in getting the vaccine out to the people. Your thoughts on the trickle-down effect that we're seeing when it comes to the vaccine and getting in the arms of everyday folk?
I think the rules are very amorphous, whether you're 1A or 1B. A tremendous amount of the population qualifies under 1B, including fat guys with high blood pressure like me. And I do also think that we don't have a unified federal response. And of course, that's Donald Trump's fault. You can't blame, people are already trying to blame Biden. It's not Biden's fault. He just took office. But I would like to say, I think Sylvester Turner's administration is doing a masterful job with what they have to work with. Everything I've heard and read about is they're, really truly facilitating the immediate distribution of the doses they have available. And usually I'm not gushing about the city, but I cannot applaud him enough. I can't speak as well about some of these outlying counties, but I think it comes down to the fact that our federal government did not put in the necessary framework for the delivery. But I do think Mayor Turner has done a wonderful job.
Dr. Carla Braley, are people who are needing the vaccine getting it in a timely fashion? I've received emails and letters from individuals saying, my mother's 93 years old and we've been in line and we've been kicked out of line trying to get the COVID vaccine. And I've seen people who are, like Charles said, in the 1B category where they could be overweight or high blood pressure, and they're getting it before the senior citizens in our community.
I have to go with what Charles responded. I think what we see is that, yes, there are some disparities in the distribution of the vaccine, but really it's related to confusion that just was not led properly through federal efforts. And with such a complex virus and the complexity of how it's impacting various populations, we know that you just have to have proper leadership to be proactive versus reactive. And I think that's what we were doing for so long. And so now we're seeing an administration that is really attempting to put people first. And so unfortunately, we're not where we should be. But I do believe, like Charles said, that leadership, particularly in the city of Houston and Harris County, are putting forth all the efforts that they potentially can do.
And I think the city of Houston and Harris County, they recently received 8,000 or 9,000 doses over the weekend, and now there's a new system that you can sign up. And of course, all you have to do is continue to watch Fox 26 to get the details on how to sign up. Where do you see the problem, Dr. Abdulla Kudrath, of being in the medical field, being on the front lines? Or is there a problem in your eyes when it comes to the dissemination of the vaccine to the public?
Yeah, it's definitely a challenging task, because even if the federal government can provide us with all the vaccine dosing, how do we go about administering it to all the citizens of Houston and surrounding areas? Even us as a freestanding ER company, we're having a hard time getting our hands on the vaccine. We don't qualify yet, even though we treat COVID patients every single day, where we have positive patients almost every single day. So with the distribution challenge, that's the step one. I'm hopeful that in the next 90 days with these new plans that I'm seeing I know the current administration wants to vaccinate 100 million Americans in 90 days. But now that if we can get the vaccine in our hands, we need processes and distribution mechanisms to give it to people. So I think it's probably going to come from retail pharmacies and grocery stores who have already set up that infrastructure to do it, as well as maybe pop-up tents and drive-through vaccination centers.
No, Dr. Kudrath, when you said you're a freestanding ER and you weren't able to get the vaccine, are regular hospitals able to get the vaccine? And is it for employees or for patients who walk through the door?
Uh, Correct. So regular hospitals have had easier luck getting the vaccine. They've been starting with their employees and staff that are first line responders. There are a few patients that do qualify for that, but it's just not enough to get around to all the patients who are walking through the door.
And Charles, go ahead, Charles.
I was going to say, it comes down to quantity. The Trump administration famously declined to buy another 100 million doses from Pfizer when they had the opportunity. And we have, as Dr. Kudrath said, you can go get all your other immunizations at CVS or Walgreens or HEB, anywhere, right? It's just about having enough of these available to the public. And it's a shame because it's all that America should have been concerned with for the last year. And we have been concerned about so many other things. And we really need to get the entirety of the federal government focused on amassing as many of these doses as we can, and then getting them into the hands of private companies to distribute them as quickly as possible. And that's why I do applaud the mayor, because I do think they are turning them around much quicker than the failures that you're seeing in New York and Los Angeles.
And of course, make sure you check the Harris County Public Health website to determine when there will be vaccines available and if they're available now here in the Houston community and wherever you are around the country.